Your doctor might be saying your baby looks a little bit big. What are some of the myths and facts that you need to know about a big baby during pregnancy? I gotta say, I see this argued a lot online. Doulas saying a big baby isn't a big deal at all, and me living in reality knowing that a big baby can be a really big issue. So how do you reconcile those two for yourself? Let me take my 20 years in labor and delivery and help you know some of the myths and facts about big babies so that you can understand a little bit more should your provider say that baby looks a little bit big.
Attention, attention. Paging the pregnancy nurse. She is a nurse, but not your nurse. Thank you.
And most of you that are wondering if baby's a little bit big are probably in your third trimester. And if that is you, I actually have a whole third trimester checklist pack that I can send you. It's totally free. I'm going to link it down below. Myth number 1 is that ultrasounds are spot on. Now, those early ultrasounds actually can be really spot on because your baby is just a group of cells up until, the end of your first trimester. And so they grow at a very definitive pace. However, when you get later into pregnancy, every baby varies a lot. And so it's considered a growth curve. What percentile, so if they took 100 babies who were the same gestational age as your baby, how big or small are they compared to all of those other babies, right? That's what the percentile is. And ultrasounds can be off by, it depends on the ultrasound device, sometimes even up to 2 pounds, plus or minus 1 to 2 pounds, which can be a lot, when this baby is only 6 pounds. I wish that we had better ultrasound technology. I don't understand why we don't by this point in time. Now, here is a fact about big babies, and it is that there are some babies who grow too big to come out of a mom's pelvis. Now, this baby is not too big for this pelvis, but sometimes the head can get stuck in the pelvis, but even worse, sometimes the shoulder gets stuck on your symphysis pubis, and that can be a real problem with really bad outcomes. So when you see people saying that there is no such thing as a big baby, know that they are lying. I also see people who say you will not grow your baby any bigger than you can deliver. Also not true. All of those things are not true. I've seen it with my own eyes. So you need to know that when they're saying things like that, that is their own perspective and not really the truth. The next myth is that there is just one method that is best to tell if baby is too big. Now, I actually have a whole video on how they tell how big baby is, and I'll link that video down below, but there's 3 basic things. They can feel on your belly, they can do the tape measure thing where they measure from the top of your pelvis to the top of your uterus, and they can use an ultrasound. And all of those different things should be used to approximate how big your baby is. Just because they feel on your belly and they think baby's big, but you get an ultrasound and baby's not, we're using all of those different things to kind of pinpoint how big baby is, because this is not an exact science. A lot of this is an art of practitioners who have lots of experience and have felt lots of babies and bellies. And I gotta say, as a nurse, I love to feel a patient's belly and then just kind of guess in my mind how big the baby was gonna be. And when you've done that with 1,000 births, you start to get really good at feeling a baby inside and knowing how big they're gonna be on the outside, which is a special skill. Not everyone has that. And I gotta say, sometimes providers will just tell you the one method was big, and it's so important to know that you have options and be able to have the communication skills to talk with your provider about what they're seeing and how to make the choice for you. A good birth class is gonna walk you through that. The class that I recommend, I'm gonna link it down below. Now, here's a fact. When they do an ultrasound, they actually measure lots of different parts of the baby. They measure the head, they measure the chest, they measure arm and femur bones, I think. And so long arms, long femurs, not as a big of a deal as big head, big, chest. I don't know if they measure the shoulders. I think it would be really difficult to measure shoulders. So a lot of times they do the chest circumference, but these things are different. Gangly arms and legs can come out real easily, but if your baby has a giant noggin on them, that can be a little bit more problematic, as you can imagine. Another myth out there is that having a big baby cannot be a reason for an early induction or a C-section. And I'm here to tell you that at 100% should be a reason for an induction or a C-section. When I see giant babies on the news, I always stop to see how they were born, because, if you have a 14-pound baby in there, I'm hoping they know that and they know that you should be having a C-section. That is not a baby that we want to try to have through the birth canal most often. I'm also here to tell you that outcomes can be extremely bad if this isn't taken seriously, which is why when I see doulas or some people on social media saying that this isn't a thing, it's really disheartening for me. And I'm so glad that you guys are here to learn a little bit more about the context and the nuance, because I think sometimes providers say you have a big baby and you may not need an induction, or you could wait. We're going to keep talking about that, but I'm just glad that you guys are here to learn a little bit more than you might learn in a 30-second social media clip. That is in fact why I have this entire channel. So if you're enjoying this channel, I would love it if you'd like it and subscribe so that we can get this content out to more people, because the 30-second social media clip is not helping anyone. Oh, and a pro tip: everyone out there should be prepared for both a vaginal delivery and a C-section delivery. And so you want to make sure that you're taking a class and doing all the chapters that cover all of those different things so that you're prepared no matter the way birth goes. I want you to feel calm and confident no matter what's happening in your delivery. And the birth class that I recommend does just that. And if you're sitting there thinking, Hillary, this birth class has got to be like 12 hours long, 3 hours, right? I want to get you guys prepared and on your way. I know that you're busy, so that's why the birth class is quick and efficient. Okay, the next fact, we got to bring my crocheted pelvis up here, and it is that a tested pelvis is a good thing. So if, you're on your second, fourth, fifth baby, and your doctor's saying the baby looks a little bit big, but you have already had an 8, 9, 10-pound baby, let's remind them that my pelvis has already shown that it is prepared to have that type of a baby. And so, a lot of people get worried because the provider's saying your baby looks a little bit big, but they have had a tested pelvis. And you can decide, was that 9-pound baby a really hard baby to push out? Then you may want to consider an early induction or possibly even a C-section, versus if that 9-pound baby slid out easy peasy, you probably do a bigger one than that at this time. So, if you've already had a baby, what the pelvis can do really helps us know if things are safe or a little less safe. We've got another fact, and the fact is that it is your provider's job to tell you if they think the baby is measuring big. I've seen some people say they shouldn't even be telling you that, and I'm like, are you kidding me? You paid for an ultrasound. If the ultrasound comes back and shows that baby is big, can you imagine if your provider just kept that information to themselves? Your provider needs to let you know if baby's looking a little bit big so that you have all the information that you have to help you make the choice. Because again, it is ultimately your choice. If your provider says we have to induce early, that is not true. It is always your choice. You just got to have all the information and then use your expert, which would be your midwife or your OBGYN, to help you know what's best for you. One more myth is that one ultrasound is enough. A lot of times people get one ultrasound that shows the baby's big and they're like, we immediately are going to induce, when in reality, maybe wait a few days and you get another ultrasound, because I am here to tell you that ultrasound techs vary quite a bit, and some tend to make every baby just look real big. I don't know how it is. I don't do ultrasound myself, and some of them seem to be a little bit more spot on. And like I've said before, the technology is not perfect. So getting a second one to see if baby's getting bigger or, look smaller, or where they are on the growth curve can really be helpful. So if they're saying they recommend an induction, you can always say, can we wait a few days and get another one to see what that's showing? I think that is really smart. And finally, the biggest myth is that there is one right answer for everyone. You have a mom's gut. If you feel like this baby is getting too big for you, let that gut speak. If you feel like you really want to try for a vaginal delivery, you can do that as well. It's always up to you. And the answer is going to be different for every single person. And I'm here to also tell you that if you try for a vaginal delivery and we think baby's on the big side, there are clues that we can watch for while you're in labor about baby's descent and how things are going that can also give us another idea that maybe baby really is too big. And if you were on the fence, it might push you into a C-section. So there is, of course, always the possibility that you could change your mind, even if you choose to try for vaginal delivery and things just aren't working out right. Remember, the choice is always up to you. It's not up to your provider. They're just there to give you the information and give you expert advice. Now, if you're wanting more information on big babies, I actually have a whole video where I walk you through it. I'm going to link it up above and down below. But thank you for joining us here on The Pregnancy Nurse, where we both give you context and nuance, and we also get you prepared, not scared, for your upcoming hospital birth.